The region saw a rise in COVID-19 hospitalizations. Ballad Health reports 21 more COVID-19 patients in their facilities today than in their last scorecard report on Friday. Ballad is reporting 310 patients being treated for the virus in their hospitals, the highest that number has been since late September. 77 of those patients are in intensive care units, 64 are on ventilators. Niswonger Children's Hospital is reporting 0 COVID-19 patients as of today. Joining us now is Ballad Health Chief Clinical Officer Dr. Amit Vashist. Thank you so much for joining us today. First, let me get your thoughts on the numbers regarding COVID-19 hospitalizations.
Thank you very much, Sarah, for having me. We obviously continue to be very concerned with the number of COVID-19 patients that we have in our facilities. You mentioned 310 patients admitted to our various facilities, with about 64 or so of them on ventilators. So one thing we have seen consistently over the past few weeks is our numbers haven't decreased, neither have they stabilized. On the contrary, they continue to trickle upwards, and you have to put that in the backdrop of more and more frontline caregivers starting to isolate themselves, getting quarantined or sick with COVID-19. So overall, very worrisome from Ballad Health's perspective, Sarah.
As of today, there are no COVID hospitalizations for pediatric patients, which is great. But last week, that number was up to 7 at one point. How concerned are you over pediatric cases of COVID-19 at this point?
I think, Sarah, we continue to monitor the situation very, very carefully. Thankfully, this morning, as we do not have any pediatric hospitalization with COVID-19. And last week, as you mentioned, we had about 7 or so pediatric patients. One age group that specifically worries us, and we saw last week, was the number of infants who were hospitalized for COVID-19. Obviously, that is an age group that is not eligible to receive vaccination. So very worried for that age group. At the same time, we would urge parents of kids who are vaccine eligible, 5 years and upwards, if you have not gotten your kids vaccinated so far, please consider doing so at your earliest convenience. But pediatric hospitalization is something we are keeping a close eye at. We have seen Children's Hospital across the country. They are filling up with COVID-19 patients, so something to keep in mind. Sarah?
Well, Ballad announced last week that they were going to be more selective as far as who is going to receive monoclonal antibody treatments for COVID-19 patients because of a supply shortage. How concerned does that make you, and can patients seek any other treatments?
Sarah, one thing at Ballad Health, like any other good health system across the country, we do is we keep ourselves updated, and we keep revising our treatment guidelines coming from respectable entities like National Institute of Health, FDA, so on and so forth. One of the guidelines that came in last December from the National Institute of Health COVID-19 treatment panel was around prioritizing monoclonal antibody in patients who merited the criteria based on their clinical presentation. And this was done because of the demand and supply mismatch. With Omicron being as contagious as it is, we have far more number of COVID-19 patients who would meet criteria for monoclonal antibody, and a very less supply of the monoclonal antibody that works. The previous monoclonal antibodies, the 2 out of 3, they do not work against the Omicron. They work against the Delta variant. So we are left basically with one brand of antibody that works against the Omicron variant, but we don't have sufficient quantities to give it to everybody who would otherwise be eligible under normal circumstances. The good news is that we have some other modalities of treatment. For example, FDA recently authorized the antiviral pills coming from Pfizer as well as Merck. So we would urge our community and folks who are positive with COVID-19, and if they were eligible for monoclonal antibody, or if they are seeking some modalities of treatment, to talk with their local doctor if they meet the criteria for getting one of those antiviral pills by either Pfizer or by Merck. Sarah?
Another big concern right now is the flu, as if COVID wasn't enough, but our yearly flu season is here. How widespread are cases right now in our area of the flu?
Thankfully, Sarah, last week we saw a decrease in the number of folks hospitalized with the flu. That is something that we are continuing to monitor very, very closely. Flu season is certainly not anywhere close to an end. And but the good news is we have a flu vaccine. We have a vaccine that actually works from getting you into serious trouble with flu or getting hospitalized. So for folks who haven't been vaccinated with the flu vaccine, the message is simple. Please get your vaccine now. That will prevent you from getting seriously ill or from getting you hospitalized. So that's our advice to anyone and everyone.
Dr. Amit Vashis, thank you so much for joining us tonight. Great information as always.
Thank you so much, Sarah.